Hi guys, so today I want to talk about double chins, and in particular the treatment that we can offer patients who have a double chin. For many patients, fat accumulation just in the neck area tends to give a very flat, unflattering look, and many patients are concerned about photos that they've had taken or just changes that they've seen, and they just want to have the jawline restored to what it was before it happened. Now, the good news is that there's a relatively quick, easy treatment with low downtime that's available, and that's neck liposuction. So the first thing that we have to do prior to any kind of procedure is to do a full examination, and we have to identify what's causing the double chin to form. Now, if it's fat just underneath the skin, then this is something which we can target using liposuction. If, however, the fat is deeper and underneath the muscle, then unfortunately liposuction won't be suitable for these patients. So it's very important that you have this assessment first before you move forward. Once that assessment's been made, and also establishment of how lax the skin is. In younger patients where the skin's very elastic, if we were to remove the fat, then the skin can snap back to its normal position and patients can get some very good results. If, however, the patient's a little bit older and the skin's a little bit looser, then we may need to do some other procedures along with the liposuction to help tighten the skin. And there are a further group of patients for whom, unfortunately, there's just too much excess skin, too much laxity, and for those, a more involved procedure like a neck lift would be necessary. But moving back to the patients who've got good quality skin and fat just underneath the skin, liposuction is an excellent procedure. This can be performed as a local anesthetic where patients are awake, and for most patients, this is generally enough. If, however, patients are a little bit more anxious about being awake during the procedure, we can offer sedation, and in more extreme cases we can give general anesthesia as well. The procedure itself takes about half an hour, 45 minutes, with tiny little incisions just underneath the chin here and just behind the ear here if we need to access stuff a little bit more towards the back of the neck. And patients typically go home the same day. They have to wear a compression garment around the neck for about a week or so, but the swelling goes down relatively quickly and patients are able to see the results immediately. The first couple of days might be a little bit sore, but with the techniques that I use, most patients are generally quite comfortable, and normal paracetamol or ibuprofen is enough to alleviate the symptoms. As I've said, the results are pretty much immediate, and they only continue to improve over the next week or to 10 days, and then the final result you tend to see at around about 3 to 4 months. If, however, there's some minor laxity associated with the skin, then I use something called Renuvion, or it's sometimes also known as J-plasma, and this is a energy-based device which helps to tighten the skin up using the same incisions that I've used for the liposuction, but it provides the energy from the undersurface of the skin and helps to tighten the skin up. Again, you need to go to a surgeon who's experienced with the use of this, because obviously if it's used incorrectly, then things can go wrong. I'm thankful to say that the incidence of that happening is actually very low. So if you are concerned about a double chin and you want an experienced surgeon who can offer a very quick, easy, low downtime procedure to take care of this, then please come and see us and we'll see what we can offer you.